Dalteparin, also known as porcine syringe, is a medication used to treat and prevent harmful blood clots. This helps reduce the risk of a stroke or heart attack. By lowering the activity of clotting proteins in the blood, dalteparin helps keep the blood flowing smoothly. It is considered an anticoagulant, commonly referred to as a blood thinner. This medication is commonly used for conditions that increase the risk of developing blood clots, such as certain types of surgeries, like hip replacement or abdominal surgery, long periods of immobility, certain types of heart attack, and unstable angina. In some cases, dalteparin may also be used in combination with other blood thinners for certain medical conditions. Additionally, dalteparin may be prescribed to treat and prevent the recurrence of clots in patients with cancer. It is important to follow the dosage and timing instructions provided by your healthcare provider for the best results. Always consult with your doctor for the optimal timing to take this medication based on your individual needs. Before using dalteparin, porcine syringe, it's important to read the patient information leaflet from your pharmacist. This medication is usually given by injection under the skin once or twice daily, as directed by your doctor. The dosage and length of treatment will depend on your medical condition and response to treatment, and may also be based on your weight for some conditions. If you are using this medication at home, it's important to learn all preparation and usage instructions from your healthcare professional and the product package. You should be lying down or sitting when you inject yourself, and before using, check the product visually for particles or discoloration. If you see either of these, do not use the liquid. This medication should not be mixed with or added to any other medication in the same syringe. Before injecting each dose, clean the injection site with rubbing alcohol, and change the injection site each time to lessen injury under the skin. To minimize bruising, do not rub the injection site after a shot. It's also important to learn how to store and discard medical supplies safely. If you are using this medication to prevent blood clots due to surgery, your doctor may direct you to start using it before or after surgery and continue for several days. It's important to follow your doctor's directions closely. To get the most benefit from this medication, use it regularly and at the same times each day. It's possible to experience irritation, bruising, and pain at the injection site when using dalteparin, porcine syringe. If these effects persist or worsen, be sure to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risk of potential side effects. Many people using this medication do not experience serious side effects. Dalteparin, porcine syringe can lead to bleeding if it affects your blood clotting proteins too much. Notify your doctor immediately if you experience any serious signs of bleeding, such as unusual pain, swelling, discomfort, prolonged bleeding, easy bruising, dark urine, black stools, severe headache, confusion, vision changes, dizziness, fainting, seizures, weakness, or numbness. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you observe any other effects not mentioned here, reach out to your doctor or pharmacist. In the US, contact your doctor for medical advice about side effects. You can also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, contact your doctor for medical advice about side effects. You can also report side effects to Health Canada at 1-866-234-2345. If you are using dalteparin, porcine syringe, there is a risk of bleeding near the spinal cord after certain spinal procedures. This can lead to long-lasting or permanent paralysis. Before any spinal procedure, it's important to talk to your doctor about the benefits and risks. Your doctor may instruct you to stop taking this medication for a certain amount of time before and after the procedure, so it is important to carefully follow your doctor's directions. The risk of bleeding may be higher if you have a deformed spine, or have had spinal procedures/surgery before, or if you are taking other drugs that can cause bleeding/bruising. These drugs include antiplatelet drugs such as clopidogrel, blood thinners such as warfarin/rivaroxaban, and nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen. If you experience symptoms such as back pain, leg numbness/tingling/weakness, or loss of control of the bowels or bladder, incontinence, it's important to inform your doctor right away. Before using Dalteparin, it's important to let your doctor or pharmacist know if you have any allergies to heparins, pork products, or any other substances. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. It's also important to inform your doctor about your medical history, especially if you have a history of serious active bleeding, artificial heart valves, bleeding or blood disorders, certain eye problems, high blood pressure, heart or kidney disease, liver disease, low platelet counts, stomach/intestinal problems, or if you have had recent eye, brain, or spinal cord surgery. While taking this medication, it's advised to limit alcohol consumption as it may increase the risk of stomach bleeding. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications and products you are using. To lower the risk of getting cut or bruised, it's important to use caution with sharp objects and avoid activities that may increase the risk of injury. Older adults may be more sensitive to the side effects of this medication, especially bleeding. If you are pregnant, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of any potential interactions with other medications when using Dalteparin, Porcine Syringe. This medication may interact with drugs such as mifepristone, as well as other blood-thinning or antiplatelet medications like aspirin, clopidogrel, or warfarin. If your doctor prescribes these combinations, you will need to be closely monitored to reduce the risk of bleeding. It's also crucial to carefully check the labels of all prescription and non-prescription medications, as many contain pain relievers/fever reducers that can increase the risk of bleeding when used with Dalteparin. If you are directed to take low-dose aspirin for heart attack or stroke prevention, make sure to continue taking it unless otherwise instructed by your doctor. Always consult your doctor or pharmacist for more information. If someone has taken too much Dalteparin, Porcine Syringe and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include excessive bleeding and bruising. It's important not to share this medication with others. Your doctor may also request lab and/or medical tests, such as complete blood count and anti-factor XA blood levels, while you are using this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Dalteparin, Porcine Syringe, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your usual time. Do not take a double dose to make up for the missed one. It's important to store Dalteparin, Porcine Syringe at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it comes to getting rid of this product, don't flush it down the toilet or pour it into a drain unless instructed. Properly discard it when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for more information. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.